Guten Tag, mein Name ist Clara Mavele und ich leite das Institut.
Hello, I'm Clara Mavelia and I'm head of the Cultural Entrepreneurship Institute in Berlin. Today we're at the Charité Teaching Hospital and my guest is Professor Hofmann. She's a senior consultant at the Department of Dermatology, Venerology and Allergology. Hello, Professor Hofmann. It's good to be back. Yes, hello to you. I'm looking forward to the interview. A few years have passed since we last met, and in the meantime, German television, ARD, has been showing that fantastic series about the Charité, particularly around the time 1880, when the hospital was just building up its prestige, its reputation, with names like Virchow, Koch, and all those big names. Can you still sense history here when you work here? Certainly. There are lots of historical sites you can still go into. In dermatology, we still have a very old lecture hall where you can still use teleoptics. Some of the equipment is still there. In the old days, they didn't have video and computers, so you had to examine the skin under teleoptics, which is one example where you can actually sense the history, and so can the students. You work here in the institute. It's basically an outpatient hospital for dermatology, venerology and allergology. Can you tell us what those are? Dermatology is the theory of classical skin disease, venerology is about venereal disease, and allergology is the study of allergies. We have all of that here together in one clinic. We have specialized subsets. We have professors and consultants who have a profile there. This TV series was on average watched by 7.5 million viewers here in Germany. The main character, Ida, was gaining work experience, if you like. She was a nurse, but she wanted to be a doctor. In those days, women weren't allowed to do that. What is it like nowadays, medical study for women? That's interesting. Quite a few women start their studies. I think almost 70% of students are women. By the time you get to junior doctors, it's about 50%. And the higher up the echelons you go, up to senior consultants and heads of clinics, unfortunately the percentage of women falls. It's rather like in other institutes as well. It's a similar pattern everywhere. So we as women have to fight to some extent to achieve those posts that the men can achieve. Well, I hope that biologically at least that starts to sort itself out. I wanted to ask you, there are studies that show that female doctors are better at medicine. What do you think about that? I think that's quite interesting, and I also feel that women are a little more conscientious than the men. They are a little more finely tuned, and they also are better at multitasking. There are studies that show that women can do lots of things at the same time, and that is typical. We can listen to the patient, but at the same time listen what the nurse is saying behind us, and possibly answer a telephone call. That's quite important. And women are also very empathetic in their dealings with patients. These days that's very important, that we don't just watch the clock, but also take the patient seriously and listen to their concerns. But what about with patients, if you have different genders? If you have male patients and female doctors and vice versa, is it a different approach? Are men shy? It varies. Everyone's an individual. A man might be more like a woman might be more like a man. What's important is to consider the patient as an individual patient, whether male or female. We really focus on the symptoms. As skin doctors, we have the advantage that we can actually look at the skin, and we don't really think much about whether this is a man or a woman. Good, okay, fine. So we have parity here in our dealings with the patient. Artificial intelligence, automation, robots, everyone's talking about them. In medicine too, and in the health system, we're seeing more and more use of these things. Can you tell us where this is already routine in your work, or what the risks and opportunities are? In dermatology, it's very important that we use our eyes, the human eye, because it's all quite tricky. And what the eye sees is well processed by the brain. Computers can't really do that yet. We have skin analysis systems which try, and they have learning algorithms too, so that these devices can learn by analyzing skin. For example, with malignant melanoma, when a mole will become a malignant melanoma. And that's quite interesting. But of course, the test question is, can it do what the human eye does? Because it's as important as tactile senses in our work. What do you think the risks and opportunities are then? I think the risk is that if we get to a point where we have so much technology that we no longer focus on the patient, if everything is systematized and you don't talk to the patient, you lose a great deal. That's a big risk. The opportunity is that you can work faster, and perhaps your diagnostic tools are more efficient. You might recognize skin cancer earlier and perhaps can then take a more individual approach with the patient, saving time for the most important thing we do, the human knowledge. If we can minimize those other times, as doctors, I'm sure that will be positive. But there are robots also that are used to care for patients in supportive functions. Yes, of course, there are pros and cons. It can be more efficient, but you miss out on the conversation. You don't touch the patient. You don't have that aspect of welfare. Of course, you can talk for a long time about the advantages and disadvantages. Of course, the combination is meaningful. So let's hope that this human interaction continues. Right, well, let's talk about skin. At our last interview, you told us that skin is our largest organ in our body. But what is skin? What does it consist of? There's an epidermis, the outside, and an inner skin. And the epidermis is surrounded by the corneum, which is a very thick coating, if you like, that protects our skin from the outside world. So you can wash your hands, you can put creams on, you can do all kinds of things to your skin, but nevertheless we still have a very good protective barrier for the skin. There are skin diseases when that layer is damaged. Okay, I have a series of questions now, which I'm sure all kinds of people ask in the course of their lives. What you always wanted to know about the skin. Let's start with babies. What's better for babies, actually, cream or powder? Definitively cream, that's the current thinking. We don't use powder often. There are studies now on how to look after babies' skins, and if you're worried, you should go along and talk to the doctor, the skin doctor. If you think your baby's skin is a little different from what you expect, then it's certainly worth consulting a skin doctor. And in puberty, what do you think? From what age is it a good idea to use makeup or shave your legs? Good question. It's a very individual question. I'm the kind of doctor who tries to see everything from an individual point of view, and you can't tar everyone with the same brush. If you feel like putting makeup on, then do it. If you feel at ease with it, then do. Same thing with hair removal. There is a natural threshold there. If it bothers you, don't do it. It won't harm you. You can start at any age, but I think it's an individual decision. Looking now at venereal disease, kids get them sometimes too, boys, girls. When should you start taking this seriously? What are the symptoms that a teenager maybe needs to think about? The most important thing is that whatever the change is, that you perceive changes. First of all, try to talk to your parents. If you don't really trust them, you can go to the doctor, you can go to a skin doctor and talk to somebody that you know. But certainly if you're getting a lot of itching or a discharge where the colour has changed, you should certainly have the courage to go and see a doctor about that. Let's come to plastic surgery. It promises a better life, professionally, or privately, more romantic involvement. Is that true? There are studies that show that if you look younger, then, for example, in a job interview, you have an advantage. The same applies if you're prettier. I take a rather different view of these things because I think that individuality is the most important thing. I think it needs to be protected, and I don't like it if individual patients don't want to be individual. There are patients that have a problem that really bothers them and they suffer from it. Then we can discuss it. What I don't like is when very young people go to a beautician or a beauty surgeon because they have some kind of ideal in mind. I think the younger we are, the more individual we are, the more beautiful we are. What do you think about surgery without pathological grounds? I think you have to feel at ease in your own skin, as we say in German. I don't completely object to it, but you can start with minor interventions, perhaps to remove a few wrinkles. You can stimulate the skin a little so that it ages better. We do muscle training every day. We need to stimulate our skin too. But whether you actually need major surgery would have to be thought about. I think there are quite a few minor things that one can do successfully. What do you think about patients or women who are actually fine, but they want to have the same lips as Angelina Jolie or the same hands as Nicole Kidman? What do you say to these people? Well, it depends. If it's easy to do and the risk is small, then you can support their individual appearance. But I immediately say, I can't give you exactly the same lips as Angelina Jolie. Often these promises are made, but they can't be kept. I look at the face and I say, quite honestly, what can the patient expect? What can we achieve? Is it possible to have those Nicole Kidman hands or those Jolie lips? It's an individual decision. That's a problem, that so many women are dissatisfied with their bodies. How do you explain that? It's triggered by advertising. We look at films, we look at adverts, and there we only see good-looking people. So you have this ideal in your mind. It has changed over the centuries, but the problem is that we try to gear ourselves to those ideals of beauty, and that's where that pressure comes from, that feeling that my body is not right and we want to be different. And of course these women's magazines as well, which have so much advertising, they almost consist of advertising. And a big problem is also Photoshop, because you can actually make any wrinkle invisible, make everyone look pretty. And often you don't recognize faces, actors, for example, on their photos any longer because they have been so changed. Everyone knows that cosmetics can't keep all the promises they make, especially as often women spend a lot more money on the same ingredients. Yes, well, cosmetics can contain ingredients which improve skin structure. We know that. But sometimes people have very high expectations of the cosmetics because the adverts promise so much more. But with good ingredients that are efficacious, you certainly can stimulate cell renewal. What's the best way to care for skin? Again, it's individual. I can't sum that up in one sentence. It really is worth going to talk to a skin doctor. There are skin analysis systems now, software, and you can offer individual advice to patients. It depends on age as well. But basically you need cleansing and nutrition for the skin. Yes, you need to cleanse the skin. You need to protect the cells, for example, against the sun. As you get older, you need a little more moisture, so you need ingredients that will encourage cell renewal. Care should consist of cleansing, a daily care, and a night care, and good sun protection. If you know the ingredients yourself, could you make these creams yourself? It's very difficult. You can mix these creams for yourself. Not a problem in itself. The problem is that they don't last long. If you do them yourself, you have a problem with shelf life because you're not using any preservatives. and often the different ingredients will decompose within the mixture. You need to know what you can mix. And of course the industrial manufacturers know, and they know how to make the consistency more pleasant as well. So probably if you have allergies, then you have to be very careful, of course. And I think now there are so many different companies producing creams that it's probably better to find a product that works for you than try to make it yourself. We don't want to do any advertising here, of course, but there is individual advice available. There's Botox, holidays, fall in love again. What do you think is best against wrinkles? Oh, that is certainly very individual. I'm sure falling in love again is very helpful, but you can't always choose when you do that, because that stimulates the hormones, that makes people feel fresher and younger. Holidays are always good too, because that stress falls away. And if you don't have that, then you can perhaps use the pills and the Botox. Are there specific male problems with skin? Yes, men tend to have that thick skin and therefore often problems with wrinkles or sun damage, because very often they lose their hair and then they have sun damage on their head. That's very male specific. But they come to you too, and you can help. Of course we can. Moles, spots, rashes. How should you respond? Moles, it's a good idea to have them looked at by a skin doctor every 2 years. If the skin doctor says you need to come more frequently, then do that. Spots, I think it's important to talk to a doctor at an early stage, because there's a lot you can do about spots. Acne can be very well treated these days, so go and see somebody quite quickly. Usually people do everything wrong. They use the wrong care products, especially young people, and you can prevent scarring. What about rosacea and rashes? Rosacea, we're seeing more and more of that. More and more patients coming in with that problem. It's very difficult because we can't cure it, but we can offer assistance. You can do care products, you can do peeling. There are care strategies that we try to put together individually. With sun protection, that's a bit of a problem, because I've seen that people in the north who really ought to look after themselves more in the sun tend to get burnt more frequently. Why is that? Well, it's quite logical. If you live in the north and the sun finally comes out, then everyone wants to go and lie in the sun. If you're in the south, then it's normally too hot for you and you'll tend to avoid the sun. It's always there. You don't need it. People always want more of what they don't have. So it's quite natural that North Germans are more likely to get sunburn, but they're also paler. They have less pigment in their skin, so they don't have to be in the sun for so long before the pigmenting can't take effect, basically. What do you advise? You don't drink 3 bottles of wine suddenly if you're not used to drinking alcohol. It's the same with the skin. If suddenly I spend 3 hours basking in the sun and I haven't been in the sun for a long time, then that's going to be simply too much for the skin. The skin also wants to be gradually inducted. That's why at the beginning, as spring moves to summer, you should look after yourself. If we're talking about damage, what about alcohol and smoking? Both of them are toxins, so they will make the skin age faster. We need to be aware of that. Classically, that means that smoking will very quickly lead to wrinkles around the mouth. These are toxic substances and they do promote aging in the skin. And the only thing you can do is stop smoking. Exactly. What about crisis? Yes, we know that we age in waves, and I have a lot of patients who are pretty stressed and say, I feel 5 years older all of a sudden. People say that, it's true. So yes, stress, difficult times can make somebody age. Why? Because we have genes responsible for aging, but we don't know enough about it. You're talking about popular sayings. What about smells? We have this expression, I can't smell somebody. That's a German expression for if you don't like someone. Well, we do know that our bodies do emit odors. And the idea is these odors are supposed to attract members of the other sex, but not everyone is attracted by the same thing. Couples are attracted to each other who like each other's odors. We get that from the animal kingdom. We search out partners that have the right smell. Okay, so it's not a bad thing. You just need to find the right partner. Absolutely, that's how it works. Makeup video tutorials on YouTube. At the moment in Germany, so much makeup is being sold that way. I think since 2012, there's been a 25% increase in sales via these videos. There's one YouTuber who is particularly popular. She has almost 2 million followers. What do you think about that? I think people simply find all these things too complicated. You want to buy some makeup, you go into a shop, how many different companies there are offering all these different products, and often you don't get proper advice in these shops. I have a lot of patients who are really grateful for makeup tips. It's really difficult, and that's why, of course, I'm quite critical about it, because with these videos there isn't an individual consultancy involved. But you can see that there is a huge market there and that patients do want to see what happens or what products might be useful for what type of skin. And you are a champion of the unity of the human, yes? Yes, that's true. If we look, every individual has their own whole personality, and it starts with sleeping. Some need to sleep more, others less. Some people like warm temperatures, others cooler. People are very different, and we tend to tar each other with the same brush, but actually I see every person as an individual, and I can see how many differences there are. Do you have a tip for our young ladies, also our young gentlemen, of course, how you can work on your own feelings about yourself? Well, first of all, you need to observe yourself. What is good for me and what is good for my skin? And of course, in life we learn a lot by trial and error. You can't get a lot wrong if you do that. Of course, tattooing is really awful because it stays on your skin. It takes years to go away. But with a skin cream or a makeup, you can try things out. And you need to listen carefully to yourself and not look to see what others are doing. Here we have the example of the new French president, who actually is visiting Berlin today with his wife, who is 20 years older. Isn't that fantastic? Yes, I think it's super. This is a fantastic example that you have this age difference, which is accepted, and that we know people don't love each other because of their age, but because of other things. That's the most important thing that we can defend in life. If you have a person you love, there's so much that's important. And you can't facelift. She doesn't facelift. No, she doesn't. That's true. You have this age difference. We can see that. You don't have to force each other to look like each other's age. Obviously, there's a harmony between them as a couple, and that's more important. You have to look at what's going on inside people. In medicine, there's a lot of talk about wait and see or treat yourself. I think there's a lot people can do for themselves. But of course, as an amateur, you can't always assess that. So if you're not sure and you feel ill at ease, then you certainly should go to see your skin doctor. But if you're feeling pretty relaxed about it and you're happy to wait and see, then maybe in 2 or 3 weeks you can't do much wrong. Okay, 2 or 3 weeks, right. What research are you doing? My main research field is acne and rosacea and therapy, progress in therapy, what can we do for young patients, but also research in skin immunity, skin rejuvenation, what devices are safe, what devices are useful, what ingredients are useful on the skin. These are the big research areas. We've heard that here in the Charité, you actually can choose freely what you research into. We don't have that everywhere. Can you tell us about that? Yes, I think at the moment we've preserved this principle. We have to make sure we continue to preserve it. That's the most important thing, that we can work here at the teaching hospital on our research, that we can train good young doctors. That's important. We have a lot of motivated young people, and the worst thing is if your work demotivates you. I think it's very important that young students are encouraged. It's a fantastic profession to be a doctor. Research is very important too. Very often we do it on the side in the evenings. But we have to say that you can't do that today any longer. You can't do good research on the side anymore. And it's important that we preserve this principle. That's why this university-type research and scholarship is so important. We need time to do this work. What would you suggest to budding dermatologists? I always think that the skin is a fantastic organ. There's so much that you can observe through the skin. And I always say, look carefully. That's what I tell my students. Take a look at your grandmother. Have a look at all the things you can find on her skin that maybe don't belong there. And there you learn to train your gaze. So when you see a patient, you can see what's normal, what's not normal. And I ask my students, what bothers you most? And I tell them what bothers me. And then we try to establish a consensus. A kind of harmony then. You were talking recently about all this modernization work they're doing at the Charité. How far have they progressed? They've made a lot of progress, but unfortunately they haven't quite finished, so it's always a bit strenuous when they are just involved in works, but I'm not so involved. I can't tell you exactly what when. But you can hear it now and then. Yes, the noise. What would you do if you had more power or impact? I would try to maintain that university spirit. That's the most important thing, I think. And I also think it's very important to be supportive among colleagues. This is really important, that we support each other in the department and don't work against each other. That is something that has kept us going as a clinic. It's a wonderful way to work. We spend more time with our colleagues, much more time than with our spouses or partners at home. And it's very productive if you know that you can rely on your department, where you can implement your own ideas and try to do that. It's much better than being told top down by a hierarchy. In this institute, in this area where you work here, there is a fantastic atmosphere. It's nice to be here, even though it's a huge setup with sometimes quite difficult niches. How do you manage to keep that up? I think it's because of that mutual support between colleagues that we're trying to preserve. If you feel good where you work and you know that you have the opportunity to keep your patients satisfied or spend a bit more time with your patients, and that you do that supportively in a team, then you have gained a great deal. And I think that does emanate to the outside, and then you know you're doing well. Well, thank you very much for your time. Until we meet again.